Hey everyone, welcome back to Gentle Dental. I am Dr. Sarah Chinnery. Go grab your favorite mug because today we are going to continue talking about nutrition and spill the beans on how food and drinks can affect your teeth. We'll talk about what foods to avoid after an extraction, what can loosen a brand new crown, and why even the healthiest snacks might secretly be hurting your smile. So let's start with what not to eat after an extraction. Whether it's a wisdom tooth or another tooth coming out, the first few days are all about protecting the blood clot that forms in the socket. That's what helps your body heal and prevent dry socket. So make sure that we are avoiding crunchy foods like chips, popcorn, nuts that can get lodged into the site. Small grains like rice and quinoa, they find their way into healing areas like glitter and carpet. Straws or carbonated drinks, the suction can dislodge the clot. Spicy or acidic foods, they can sting and irritate the healing tissue. So let's talk about what you should eat or can eat. Stick to soft, cool foods. Think like mashed potatoes, scrambled eggs, yogurt, or smoothies with a spoon. And remember, healing gums are delicate, so even small food particles can delay recovery. If you notice a little bleeding after an extraction, one of the best home remedies is actually a black tea bag. Yes, like regular Lipton or English breakfast. Black tea contains natural tannins, which help constrict blood vessels and encourage a clot to form. Just steep the bag in hot water for a minute or two. Let it cool until it's warm, not hot, and squeeze out the excess water and gently bite down it for about 20 to 30 minutes. It's an old fashioned trick that really works. The tannins act like nature's little clotting agents, and the gentle pressure helps stop the bleeding. Just make sure it's black tea, not herbal or green tea, since those don't have the same effect. Next, let's talk about crowns. If you've ever had a temporary crown placed, you've probably got the no sticky foods talk. That's because chewy or tacky treats like caramels, gummies, fruit snacks, and taffy can literally pull the temporary right off. Even once the permanent crown is cemented, it's really smart to try and go easy on those foods. Sticky textures tend to kind of wedge themselves in between the teeth and under the edges of the crown and can loosen the cement seal over time. If you love things like dried fruit or gummy vitamins, make sure that you're just rinsing really well after eating and brush once you're able to. All right, so now here's the part that surprises most people. Cavities aren't just about sugar. They're about acid attacks and how long your teeth stay in acidic environments. Every time you eat or drink something other than plain water, bacteria in your mouth feed on leftover carbohydrates. That includes sugars and things like crackers, chips, and bread. Those bacteria release acids that lower the pH in your mouth. A healthy pH for saliva is about 7, which is neutral, and enamel starts to demineralize at around 5.5. That means if your mouth stays below 5.5 for long periods of time, that's when your enamel gets softer over time, allowing the cavity to form. And here's the kicker. Every time you take a sip or a bite, even a small one, that 20-minute time clock starts over. So if you are sipping on soda or snacking all day long, your teeth never get a chance to recover. We usually think of soda as acidic, and it is. Most of the pH is around 2.5 to 3.5. But did you know that some flavored waters and sparkling waters can dip below a pH of 5? Sports drinks often fall between 3 and 4. And even fruit juices and vinegar-based dressings can weaken enamel over time. Now, let's talk about something that surprises everyone. Bottled water. Not all water is created equal, especially when it comes to your teeth. Most bottled waters have a pH of between 5 and 6, meaning that they're slightly acidic, low enough to contribute to enamel wear over time if you drink them consistently. Some even have a pH close to soda. Meanwhile, tap water actually typically has a closer pH around 7. So if you are drinking bottled water all day, here is a pro tip. Check the brand's pH online because you'll be surprised. I believe spring water typically has a higher pH than some other ones. So that is something to really look into. I am not here to take out the joy of food but I just want you to help enjoy it smartly. Here's what really helps: limit snacking frequently. Try to give your teeth a full hour or two between meals to recover. The best option would be to get to a toothbrush and toothpaste 20 minutes after you eat or drink. But if you can't get to that, at least rinse with some water. Chew sugar free gum. It boosts saliva flow, your body's natural buffer. And you can also eat cheese or milk after something acidic because dairy helps neutralize acids. And remember, it is not about perfection, it's just about awareness. So whether you're healing from an extraction, protecting your new crown, or just trying to help keep your enamel strong, a few small changes in your eating and drinking habits can make a big difference. If you found this helpful, give it a thumbs up, comment with your favorite smile friendly snack, and don't forget to subscribe for more calm, clear dental education every week. And if you haven't yet, check out my last video on nutrition. It pairs perfectly with today's topic. Until next time, keep smiling, stay curious, and thanks for watching.